Good afternoon, everyone. We're going to go ahead and begin the webinar. Thank you for joining us this afternoon. My name is Courtney Wheeler, and I am a Public Health Program Manager here at the National Indian Health Board. As many of you may know, NIHB was created by the tribes and advocates on behalf of all 574 American Indian and Alaska Native tribes. NIHB is divided into 3 departments. We have a policy center, a congressional relations department, and the public health and policy and programs department, which is the department that I am work in. Through the departments, we do a variety of work ranging from technical assistance to programming, some policy work, as well as advocacy. This afternoon, our webinar will be on contact tracing in Indian country. There will be 2 presentations. The first presentation will be from the Albuquerque Area Southwest Tribal Epidemiology Center. Dr. Amy Dixit and Carolyn Parshall will be the presenters. Our second presentation will be from the Community Outreach and Patient Empowerment, or COPE. Dr. Sehn, Hannah Sehn, and Rexine Williams will be the presenters for that portion. Before our presenters start, there's a few things I would like to go over. Just a reminder, this webinar is being recorded, and after the webinar, within a few days, the PowerPoint as well as the recording will be available on the NIHB COVID-19 Resource Center webpage. I also want to remind everyone to please make sure your phones and computer microphones are on mute, just to minimize the background noise during the presentation. Once this webinar is over, you will receive a link via email to an evaluation. We ask that everyone complete the evaluation, as it helps us prepare for future webinars to make sure we are providing information and resources that you all are looking for. At the bottom, excuse me, at the bottom of your screen, there will be the chat box. If you could place all of your questions and comments in the chat box, and we will be periodically addressing your questions or concerns throughout the webinar. However, at the end of this presentation, there will be a Q&A section for you all to ask questions pertinent to contact tracing. I will now turn it over to Dr. Dixit and Carolyn. You will be able to share your screen.
It's still disabled.
Give me 1 second and I will double check that. Okay, you should be able to share your screen now.
You can barely hear it. Yeah.
Okay. Thank you. I will try to speak louder, and also please make sure you keep your microphones muted. And if you have any comments, to put them in the chat box. That way we can minimize the background noise.
Is this visible?
Yes, it is.
Great. Okay. Well, thank you everyone for joining us, and thank you to NIHB for providing us an opportunity to discuss this really important topic with our communities. I'm joined by my colleague, Carolyn Parshall, and together she and I will walk you through some of our experiences with the COVID-19 contact tracing in Indian country, and delve a little bit more specifically into how we at Aztec have been handling the contact tracing efforts with our communities. So before I go too deep into what contact tracing is, I want to take a moment to share a little bit about myself. So my name is Amy Dixit. I am one of the epidemiologists and a student development director with the Albuquerque Area Southwest Tribal Epicenter. But our parent organization is the Albuquerque Area Indian Health Board, which is a health board made up of a consortium of 6 tribes serving all of the Albuquerque area IHS service area. And we have several programs, including Aztec, which is how the Southwest Tribal Epicenter is known, as well as an HIV/AIDS prevention program and audiology program. So I'm going to pass it to Carolyn to share a little bit more about herself, Aztec, and who we serve.
Thanks, Amy. Hi, everyone. My name is Carolyn Parshall. I'm also an epidemiologist with Aztec. I'm born and raised from Albuquerque, New Mexico, and I'm very happy to be here talking to you all today. So Amy and I are both epidemiologists with Aztec, and that stands for the Albuquerque Area Southwest Tribal Epidemiology Center, which is housed with NIHB. We are one of 12 tribal epicenters across the country.
Some sort of contact tracing that, oh, I don't want to be.
Sorry, I think okay, there we go. So we're one of 12 tribal epicenters across the country, and we focus on health research, surveillance, and training within the 27 tribal communities that we serve. And on that map in the slide, you can kind of see our service area. It encompasses New Mexico, Southern Colorado, and parts of Texas and Utah. So we can go ahead and move to the next slide.
So I'll talk a little bit about what contact tracing is. I'm sure it's at least by name familiar to most of you, but we happened to find this graphic from the Florida Department of Health website, so we added the URL there should you want to refer to it in the future. But basically, contact tracing is a core disease surveillance activity. It is not, specific to COVID-19. It's been done for many other diseases, most of which are infectious in nature. So if you think of communicable and reportable diseases like chickenpox or measles or HIV, or even foodborne diseases, contact tracing occurs there. And in essence, it is a way to identify your case and get them into care, but then talk to them about who they may have been in contact with in a way that may transmit that disease within the infectious period. So for COVID-19 specifically, it's a person-to-person transmission, although there are reports of it also being more airborne. But in our case, we're looking at who their close contacts are. And so we ask the patient, when did you start developing symptoms? 2 days before you started developing symptoms, who were the people you spent at least 3 or more minutes speaking to within 6 feet? And those are the people we bring into the monitoring loop. And all we do for the monitoring is to make sure that if people are going to develop COVID-19 symptoms, we are asking them to be in quarantine, and we're making sure we are staying in communication with them should they have questions or should they develop symptoms. And we follow them, we monitor them for the quarantine period, which for COVID-19 is 14 days for anyone who doesn't live with the case. For those who live with the case, it's longer because we follow the guidance that's issued by the New Mexico Department of Health, and we follow their contacts for 14 days after the initial household case has recovered. So Carolyn's going to talk a little bit more about why contact tracing is important.
Yeah, so why do we do contact tracing? As Amy mentioned, we know that contact tracing is one of those tried and true public health strategies that's been used for decades to control the spread of infectious diseases. Ideally, contact tracing will identify the individuals who may eventually need to get care and treatment, and it will also prevent further transmission of disease by getting those close contacts into quarantine as soon as possible after an exposure to a confirmed case. Contact tracing is especially important with a virus like COVID-19, where we know that individuals can be asymptomatic. So they may not know that they have the virus until they get tested. And likewise, the people that they have come into contact with may not know that they've been around someone with the virus, and they would, otherwise have no indication that they need to stay at home so that they're not potentially spreading it to even more individuals. You can go to the next slide. So now we're going to talk a little bit about how Aztec got involved in contact tracing within New Mexico. This kind of goes back to April, and initially the State Department of Health in New Mexico had been handling all case investigations, but like many other health departments, they were becoming overwhelmed just with the sheer volume of cases. And through the partnership that Aztec has developed with our department over years of working together, it was decided that we were in the best position to take over contact tracing activities in the state's tribal communities where this wasn't already being done by the tribal clinic or by IHS. So at this point within Aztec, we formed 8 teams to work with each community, and each team is led by either an epidemiologist or evaluation specialist, and also consists of additional AA, IHB, and Aztec staff who help out with the contact monitoring. And Amy's going to get a bit more into the details of what contact monitoring looks like at Aztec.
So sorry, am I muted or unmuted? No, I'm unmuted, sorry. So what it looks like with our teams is that, as Carolyn mentioned, we have 8 teams and they're led by either an epi or an evaluation specialist. And each of these teams are responsible for 1 or 2 communities individually, and they work with within AIHB and Aztec with other staff, but we also connect with the New Mexico Department of Health to gain access to the reportable disease database, where we can see the cases that are assigned to Aztec, and then we begin the case investigation. So the CDC has issued various case report forms, and so the New Mexico Department of Health has modified some of the case report forms to get a really in-depth and comprehensive questionnaire going for anyone who tests positive for COVID-19. And Aztec's responsibility is for whichever team lead is assigned a case, we go ahead and conduct a case investigation. So we go through, we call that person up. Ideally by then they've already been contacted by their provider to let them know of their case status. So we walk them through the questions that the Department of Health has with regards to potential exposures, whether or not they're epi linked to another case. So, you know, that usually happens in the case of a household contact conversion. If they've had any travel. More recently, since New Mexico has begun to open back up a little bit more, they've added new questions into the questionnaire with regards to has this person been to any congregate settings such as a bar, a restaurant, a gym, salon, religious service, or a community event. And this is really just meant to get very down into the details with regards to, you know, tracing outbreaks, trying to figure out what might be exposure settings that are putting people at a greater risk for contracting COVID-19. So as part of the case investigation, we also do contact tracing. And that is precisely as Carolyn and I were mentioning earlier, where as we're talking to the case, we talk to them about, okay, well, are you symptomatic? If you're symptomatic, when did your symptoms develop? Okay, your symptoms developed this day. Can you think back to 2 days before your symptoms developed? And can you tell us who you spent more than 3 minutes with, you know, talking, sharing food? I mean, it's obviously going to be people they live with. Maybe they went to work. Maybe they did go to a community event or a religious service. And so we get down as much information as we can with regards to who their contacts were during that potentially infectious period. You know, we try to ask for name and phone number at the very least. And we try to understand when their last date of exposure to this case might have been, because that is really going to determine the contacts quarantine period. So armed with as much information as we possibly can from the case itself, you know, we go ahead and we begin our monitoring. So in many communities, Aztec is also responsible for the case monitoring aspect, which is to say, for the duration of that case's illness, we're calling and checking up on them, asking about their symptoms and talking to them about, you know, how they're feeling. Are things improving? For asymptomatic cases, we call them for 10 days from their last positive case to make sure that they're not developing any symptoms. And then after that 10-day period, we can declare them recovered. For symptomatic cases, we want to see an abatement of respiratory symptoms or significant improvement of symptoms, and at least 3 days afebrile without medication. And that's for the case monitoring, but the contact monitoring, we try to go back to our contact tracing notes. We get as many phone numbers as we can. For a lot of communities, we have good partnerships with people who are able to provide us with phone numbers of their enrolled members. So we try to get as much information as we can to communicate with them effectively. And we get them into our monitoring system and follow them for 14 days if they're not a household contact, or for 14 days plus the duration of the case's illness if they are a household contact. And then the last part involves reporting out to not just the community itself, but also occasionally to IHS if the clinics are IHS clinics, or to the clinics themselves if they're 638'd. And of course, a degree of reporting back to the Department of Health, because again, this is a reportable disease. So there is a lot of communication that goes into our efforts, and that is really sort of the key to it all, effective communication. And, we've managed to develop really deep and strong relationships with a lot of our communities that we're working with on these efforts. And we're grateful to them for engaging in strong communication with us, because it really does help to strengthen our contact tracing efforts.
Okay, so we were asked to speak today a little bit, specifically to some of the more common challenges we've encountered and lessons learned doing this work. So I'm going to talk a little bit about, working directly with communities, doing the contact tracing. And, most of the challenges that we find in this space involve finding ways to help people effectively isolate if they have tested positive, and effectively quarantine if they've been listed as a close contact. So one of the strengths of many of our tribal communities is the focus on family and close family units, but this has also posed a challenge in that many homes within our communities may be multi-generational and have many family members living there, ranging all the way from children to elders. And this can make it difficult for people to effectively isolate in one part of the home and use a separate bathroom from all other members of the household, which we know is critical in avoiding the spread of the virus to others in the home. And this has been addressed within our state through the establishment of alternate isolation sites. The Department of Health has helped in contracting with hotels around the state to allow individuals who need to isolate but are unable to do so in their own home to stay in these hotels until they meet criteria to discontinue isolation and go back home. Individual tribal communities have also established alternate isolation and quarantine sites through repurposing mobile homes and trailers for tribal members to stay at while they're either recovering from COVID or going through their quarantine period. And having these alternate sites where cases and contacts can stay has been really helpful and successful in preventing the spread of COVID within large multi-generational households. Another issue that we've run into is figuring out how to get resources out to people's homes or wherever they're staying at so that they don't have to break isolation or quarantine to go out and run errands. Sometimes these periods where people have to stay at home, as Amy has mentioned, can last for weeks or even longer. And not everyone has access to drinkable water and or electricity. So getting items like fresh food, water, pet food, cleaning supplies, and medicine out to people's homes is really essential in making it as easy as possible for them to stay at home and successfully isolate. And this is where having strong tribal programs within communities, many of which have been arms of clinics and CHR programs, has been critical in supporting tribal members by delivering essentials out to homes and dropping items off on doorsteps so that there's really no contact involved and the people who are in isolation or quarantine can just focus on staying home and taking care of themselves. And lastly, I want to talk about issues actually getting in touch with individuals, both cases and contacts. All of the contact tracing work that we do at Aztec is done over the phone, and many of our tribal communities can be in remote locations. So we have had difficulties contacting individuals who, don't necessarily have reliable phone service, or maybe they don't have phones at all. And this is another instance where having a strong relationship with the clinic or the incident command team within the tribal communities is really imperative, because oftentimes they'll know who has spotty service at their home. They'll be able to connect you with a case's next of kin. They'll know who doesn't speak English. And, if all other attempts to contact a case fails, some of our communities are able to have the public health nurse or CHR go out for in person for a home visit. So I'm going to pass it over to Amy now.
Thanks. And, just to reiterate, one of the really critical elements of success when it comes to contact tracing is that communication piece. Whether it's communicating with your incident command team, with the community you're serving, whether it's communicating back to your team members that are also doing the monitoring, or it's communicating with IHS or the Department of Health, it is a really, really critical element to improving the system, to continuously rework the system so that it can be successful. With regards to Aztec, our director, Kevin English, has weekly meetings with IHS and Department of Health to follow up on what there is that should be shared with us, if there are changes to the protocol, if there are new developments we should be aware of. As team leads, the EPIs and the evaluation specialists who run the investigations also meet weekly with the Department of Health to go over any changes to the protocol, any changes to new health advisory notices, or any changes to quarantine or isolation procedures, talk through any issues we see in the Department of Health database. We also, Carolyn and I are also part of a team of 3 epidemiologists that facilitate a weekly call with our tribal partners. So Aztec hosts a weekly call with our tribal partners, and we invite our partners to come and share some of the challenges they're experiencing, some of the successes they have experienced with regards to COVID-19. We try to promote the best information we have available at the time. If there are any changes to guidance issued by CDC or DOH, we try to make sure we clarify that and present that so that it is more broadly accessible. Funding announcements are also shared during that weekly call. Our tech director meets with other tech directors, so the 12 sister techs meet weekly to discuss any changes that they anticipate coming in, any funding, any particular issues that other techs might be able to brainstorm to work to solve. So again, this is a really, really critical piece of making sure that we work through the bumps, because this is a bumpy ride, and that we work to mitigate some of the challenges, and that we try to communicate effectively with not just each other, but also our partners. And then one of the last things that we wanted to share is that this pandemic obviously takes its toll on everyone involved. But I mean, it's a global phenomenon, and in the United States, we've been enduring it for quite a while. In New Mexico, we received our first case in about mid-March, and so we've been dealing with this for quite a little bit. And one of the key concerns that we've had, and we've tried to be aware of and work to alleviate, is mental health strain for not just ourselves, but our staff. For a long time, some of our teams were working 7 days a week, because that's just how quickly the cases were rolling in. And it is really imperative that we address the cases and the case investigations right away, so that we can get tracing done as quickly as possible and get people into isolation and quarantine as quickly as possible. So as the cases rolled in, especially in later spring, we had teams working 7 days a week, occasionally 12, 14 hours a day. And it's not sustainable and it's not healthy, but it was necessary. And so everyone stepped up to the plate to do what was necessary. But we also wanted to think about how do we take care of this and how do we help them not burn out, because that is a very real possibility. And one of the things we've implemented recently is a rotation for a weekend schedule so that it's not every single team working every single weekend. So people can try to take a weekend off. And we've also tried to incorporate some focused conversations with some of our social worker colleagues into team meetings so that we can have a chance for everyone to sort of express their fears and frustrations, their feelings, get some validation for all of their efforts, brainstorm some healthy ways of coping, talk about what's working for them in terms of coping and stress relief, share that with others, provide an opportunity for, everyone to just kind of get that off their chest. Also, it can be really taxing because people on the other end of the line are scared and they don't know you. And sometimes they're dealing with complications of the disease. Sometimes they're dealing with loss in their family due to the disease. And it can weigh on you quite a bit as someone who is there to help, but it has limitations to how much you can help. And so, we're not always necessarily trained to be trained in that sort of mental health and behavioral health realm where we know what the right thing to say is. And so we do sometimes take it on ourselves and we're left to deal with these feelings on our own. And so one of the things we try to encourage with our team members and ourselves is to have an opportunity to share that and to talk to some of the behavioral health professionals we have working at our organization so that we can find healthy ways to cope.
Okay, so lastly, before we wrap up, we wanted to provide everyone with some tools and resources that we have either created at Aztec or that we have found useful in doing contact tracing work. At Aztec, we're very fortunate to have staff who are also artists, and within our organization, we have developed culturally tailored fact sheets and materials that we use to support contact tracing activities. We have multiple fact sheets that we offer to send directly to cases and contacts when we reach out to them. And these fact sheets have information on how to isolate and quarantine, other things like how to talk to children about COVID-19, as well as special considerations for at-risk groups. And here on this slide, we have a couple infographics supporting physical distancing and wearing a mask with original artwork done by our staff. And all of the materials that we've developed are available for download on our Aztec website, which is linked up right there. And we also have an order form linked to the website where individuals or tribal programs can request to have materials printed and mailed to them in different sizes. We have done poster versions of infographics to hang on the outside of doors. We have postcard size materials for tribal programs to include in their food and water deliveries. And we also have coloring sheet versions of our infographics to send out to children who are stuck at home right now. And we also have the link to the Tribal Epicenter website because we're definitely not the only tech doing contact tracing work throughout the US. So if you're interested in learning more about this work in your specific area, please do reach out to your local tech director. And we've also included several links to free online courses on how to do contact tracing, as well as a link to CDC materials and resources that may be useful to others wanting to get involved with this work. So that is all that we have for the Aztec slides. Thank you very much for your time. And I think at this point, we'll go ahead and pass it along.
Thank you for your presentation. Cope, if you are ready, you can share your screen and begin your presentation.
Thank you. This is Sehn speaking, and I'm going to start off and then invite my colleagues Rexine and Hannah to also talk about the work that they're doing. So first of all, it's just really an honor to be invited and to share a little bit of the experience of what we've been doing with contact tracing, and I really appreciate all of the information that Carolyn and Amy shared. I think that was just really beautiful context to really map out how contact tracing is done and why it's so important. A lot of the lessons learned that you commented on really resonate with our experience as well. And our perspective might be a little complementary because what we're going to share with you today is really the work that our team has done formally under the unified command of Navajo Nation's case management strategy. So it's really, in a sense, kind of talking about that perspective, working, with that role. Next slide. So just by way of introduction, my name's Sehn, and I'm actually appointed to be leading up the contact tracing initiative for Navajo Nation under Unified Command. And our organization is called COPE. It's a native 501c3 that's based in Gallup, and we've been working with Navajo Nation for about 10 plus years. And so as COVID began to emerge, Navajo Nation leadership looked to many different partners, from grassroots all the way to, collaborating nonprofits and academic partnerships to really bring together a huge number of collaborators. And it's just been a real honor and an inspiration to be working in solidarity with such a coordinated response. And I think many of you are probably aware that the Navajo Nation, from the leadership standpoint, has taken quite aggressive public health measures to contain the spread of COVID-19. And at the same time, we've seen activists at the community level also play a big role in raising awareness, such as artists, getting resources for community health workers, ranging from sewing cloth masks to getting donations. And I think it's just been very inspiring to see that the community has been very unified and not divisive in the way that things have how we've responded to COVID. So the next slide really kind of talks a little bit about the 4 pillars of case management for COVID-19. And I think our previous colleagues did a really nice job of describing all of these in different ways. And I'm happy to go into any of these in more detail in the Q&A. But first, of course, is expanded testing to make sure that individuals who do need to get tested, including asymptomatic contacts, that everybody should have access to testing. And we're very fortunate now that Navajo is able to offer testing to all those who want it. The second, of course, is contact tracing, which we'll talk about in more detail. And I did just want to kind of mention the other 2 pillars because, in essence, contact tracing doesn't really work unless all of these pieces are sort of clicked together as a larger support structure. So it really is, kind of a network of support all the way from the clinic, out to the homes. And so the home support, similar to what was previously described, involves quite a coordinated effort on supply chain to make sure that families are getting the essentials that they need in order to safely isolate or quarantine. And also similar to what was previously described, for those who can't stay at home and safely isolate, there are a number of places on Navajo Nation that are offering isolation facilities, sometimes called respiratory shelters. So on the lower left-hand corner is a picture of an individual staying in one of the hotels in Gallup, which allows not only for individuals to safely quarantine, but also to get pretty close attention because there are providers who are rounding on the patients. They're getting calls from certified peer coaches, care coordination, they're getting medications if they need it, and food, etc. So I think that that's been really nice to see, especially from an equity lens, because oftentimes the people who can't isolate are the ones who are experiencing homelessness or housing instability. So they're really folks who, pre-COVID were in some ways, kind of falling through the cracks. So I really appreciate the fact that many of the COVID efforts have been rolled out with an eye towards equity. So I wanted to really just kind of take a pause before handing it over to Rexine and acknowledge that, again, we work with so many different partners, and we're going to talk a little bit more about the central contact tracing workforce that we're building, currently comprised of volunteers, and Rexine will talk about that in more detail. But this is not to underplay all of the clinical staff at the 12 Navajo area facilities who have been standing up case management and contact tracing since day one. And I think, similar to some of the earlier comments, one of the reasons we wanted to build an additional kind of volunteer workforce that could flex out to different sites was because we were worried that, the burnout rate of people who are just going nonstop can be very, very challenging. We also work with the CHRs who are the front line and first responders, and bringing those needed resources out to the community. And I just really appreciate the vision and the perspective of all of our partners to be, to take this moment of crisis to as an opportunity for innovation, because none of this has been built. And so in some ways it's really an amazing opportunity to see, how much creativity exists among our partners and our teams. So in that sense, I think, it's been, again, very nice to be able to design programs that are not only first and foremost designed to address the immediate needs of stopping the COVID spread in Navajo Nation, but also, with an eye towards the long view and making sure that we're laying down planks of equity that will create local capacity, local public health professionals that will become leaders in the coming years, and also data systems, as Hannah will describe, that are managed and overseen by Navajo Nation, so that we can really promote the intentions and the data sovereignty of the nation. So with that, maybe I'll just turn it over to Rexine and allow her to talk a little bit more about contact tracing. Actually, this last slide is probably less important, because I think many of these items were in some ways described in the previous lecture, but I think this is just really just to describe some of the areas that our team as COPE are specifically supporting Navajo Nation in doing. Probably more important to turn it over to Rexine. Thanks. Oh my goodness, it keeps going. I'm so sorry, I forgot about these. This was actually just an example of some of the workforce staffing that we have provided as just data that can help sites inform how they're going to organize their future staffing needs for COVID. So this kind of is an example of one of the sites that has allowed the team, for instance, this is a hypothetical example, but for Fort Defiance to understand, okay, based on my case rates, this would be kind of the staffing need that would be appropriate for our facility. And one thing that we did realize is that there is a very heavy component of data and data support, and oftentimes this is an area that is lacking in the current health facility structures. So I think the last slide, sorry, Hannah, the last one is kind of an example of how, because COVID is dynamic, the rates of new cases per day, for instance, in Gallup, have fluctuated from 75 per day down to about 5 to 8, and I think now is around 9 to 10. And so accordingly, the staffing needs might change. And so this is, again, an example that our team has worked to develop based on national workforce projection models that exist out there to kind of provide additional planning tools for the sites.
Thank you, Sonia. Yata She'e Rexine Williams Yunsha Na Ke Dina Inchla Touchy Ni Bushes Chin Kia Ani A Shache Bilagana A Chanela. Hello, my name is Rexine Williams. I'm a lead trainer and team leader with Partners in Health, and I'm an advocate for Indigenous health. As you probably know, the Navajo Nation is one of the most impacted communities in the world. My family has worked and lived on the Navajo Nation for generations. I was raised in the small, tight-knit community of Kayenta, Arizona, and I am familiar with the challenges that existed before the pandemic, and I am now very familiar with how COVID-19 has exposed the continued presence of these very challenges today. I'm very grateful for Partners in Health contact tracing program, which gives targeted communities access to resources that allow communities to heal. I'll be sharing some aspects of how our volunteer contact tracers are trained by our program. The Volunteer Contact Tracer program strategically chose to focus on local support, young Diné public health professionals. We strongly feel that they are best suited to support Navajo patients with the passion they use to serve their people, and their training is an investment in long-term local capacity and expertise. A skilled workforce of contact tracing volunteers will not only help to stop the spread of COVID, but their training will build a lasting public health professional workforce. Contact training volunteers receive free training and certification as a COVID-19 contact tracer. The volunteer training is a combination of online learning, live webinars, and small group virtual meetings with the constant and accessible support of lead trainers and team leaders. Volunteers receive ongoing training through weekly sessions to build skills and knowledge as they develop. Before they are activated, Partners in Health and the Navajo Nation requires that all contact tracing volunteers must be credentialed through Navajo Area Indian Health Services or the Navajo Department of Health. The volunteers must register as contact tracers through the Arizona Emergency System for Advanced Registration of Volunteer Health Professionals Volunteer Portal and complete training before they can be activated. Our trainer program occurs in phases. In phase 1, we start with training and registration. Training requires approximately 20 hours from volunteers. In that time, we use 3 live Zoom meetings that last about 2 hours long, and we use role-playing with scripts and tutorials about how to use CommCare. These scripts are designed within the context of the Navajo Nation and prioritize the livelihood of the Navajo people. After each training session, our volunteers have homework, which includes Indian Health Services HIPAA training, contact tracing training through either ASTHO, which is the Association of State and Territorial Health Officials, or Johns Hopkins University online COVID-19 contact tracing program. By the second week, the volunteer has one-on-one time with a trainer where we give an assessment with role play and CommCare application use. The assessment marks the completion of all necessary trainings, and all certificates are uploaded to the Arizona Department of Health Services volunteer portal and phase 1. In phase 2, our volunteers begin contact tracing calls, and we ask volunteers to commit a minimum of 3 to 4 shifts per week to fully support our providers and patients. The case management team at Navajo healthcare facilities are understaffed and overwhelmed like most health facilities, so we welcome as many hours as they can provide. In the first 2 weeks, we encourage volunteers to sign up for as many hours as they can as they get comfortable with calling. Before each shift, we have a team huddle. Teams Zoom in and we discuss their assignments and answer any questions our team may have during each shift. And during each shift, we have team leaders and case managers available through text messages, phone, or email to answer any questions our volunteers may have. Communication is so very important in all of this. First, we have our volunteers who note detailed reports of their conversation with each patient. Those notes are available to volunteers that will be working next with that patient, and for the case managers that are on those cases. If there are situations requiring immediate attention, the volunteer will contact a case manager or ask the patient to call 911. Next, we have refresher trainings weekly where we can focus on building skills, trainings on mental health support, or where we provide updates for our volunteers. We also have weekly check-ins with our team leaders in a smaller setting where we ask about any challenges or highlights of the week, and really just to check in on the mental health of our teams. We really want to make sure we are there for them if they need us. And once every 2 weeks, our team leaders will schedule a one-on-one with each member of their team. During this one-on-one, the team leader can debrief with the team member about what's working well and what's been more of a challenge. They'll also provide coaching to the volunteer and address specific issues of performance, attendance, and stressors. The volunteer teams are made up of dedicated Navajo community members, and the contact tracing program creates a platform of service for community members and others who want to be in service to the Navajo communities. The certification process and experience in such uncertain times not only helps connect the Navajo people to resources for their healing, but adds skills to a workforce that strives for sovereign care. Our training strives to equip more Navajo community members with more skills that will allow them to sustainably serve their communities. And this is just the process in which we train in currently today. And next is Hannah.
Great, thank you, Rexine. So good
Sure.
afternoon, everyone. She'e Hannah Sehn Yanisha, Community Outreach and Patient Empowerment Binashnish. So it's really nice to be able to connect with all of you. I work with the Community Outreach and Patient Empowerment program that Sonia had mentioned earlier. And I know that we're getting close on time, but I did just want to take a few minutes to share a little bit more about the system that we're working on with Navajo Nation. So as Sonia mentioned, we're working really closely with all of our partners across Navajo Nation, and this absolutely would not be possible without all of the teams at the health facilities and also the community teams like the community health representatives who are really putting in all of the, the long hours and providing us with a lot of feedback. And specifically, we've been working under the leadership of the Navajo Epidemiology Center, and we've been working together to be able to implement an electronic system to help to facilitate the case investigation, the contact tracing, and the follow-up. And so, as you can see here, the system that we've been collaborating to use is the ComCare system, and this is developed by an organization called DMAGI that we've worked with over the past several years, and the Navajo Epidemiology Center has as well. And it was the Epidemiology Center that chose this system to use, and so the teams across Navajo Nation have started to implement this system over the past several months. And it's been really exciting because under the Navajo Public Health Authority, this actually helps to create an opportunity for this information to be housed with the Epidemiology Center. So the Epidemiology Center is the repository for all of that information. So just thinking about the response and how to be able to make sure the resources are there for the communities that need it, this system really is working towards helping to make sure that that information is able to be shared in a timely fashion. So in the pictures here, this is showing what the system would look like on a mobile device. As was mentioned, most of the teams are actually doing the contact tracing virtually, so it also can be used in a web-based system, and it is a HIPAA secure system. But what is also exciting about it is it does have the capability to work in a mobile or tablet-based system, and that's what you can see here. And so this has been really exciting because it's provided an opportunity to receive feedback from our community partners, so like the CHRs and the public health nurses that are out there providing the resources and care in the community, to be able to think about how to have a system that connects the home support, as Sonia was mentioning earlier, with the day-to-day case management. And so Navajo Nation has those teams under incident command, and so has been really thinking very holistically about how to ensure there's a very seamless system in place. And so as you can see from the picture here, some of the features that the system has is that it can help to have very specific assignments for a particular worker. So we've been able to use this system to be able to integrate the volunteer workforce that Rexine was talking about just a little bit earlier, so that they can work very closely with the health facility team. And we've been able to tailor it to the feedback from our partners. So we really have been so grateful to the sites who have been willing to implement this. So all of our partners from, Tuba City, Chinle, Kayenta, as some of the early teams that have been giving us feedback, and then all of the teams across Navajo Nation that have been sharing feedback with us to make sure that it's continually improved, but also that it's really tailored to what would be most important in the community. So the other feature that the system has is that it can also help on the back end with reporting functions for the sites, and really thinking about, from the Navajo Epidemiology Center's perspective, what's the information that would be most helpful for them to receive from across the different sites. So maybe I'll just pause there. I know there's only a few minutes remaining, but I do want to just make sure everyone has the opportunity to be able to address some of the questions that have come up, and we're certainly happy to share more information on the ComCare system. I think what's really the most exciting is that it's a way to really promote data sovereignty and to be able to help to facilitate information being shared instantaneously. So whenever our volunteers, for example, are working with the health facilities, it's really helping to connect them. And then for the health facilities that have been implementing this over the past several months, it's a way to be able to connect those teams. And some of the additional suggestions that we've received in terms of the functionality also will help to connect the individuals in the community that are providing that home support and that follow-up for individuals that maybe need to quarantine or might need to isolate, that's also going back and connecting with the team that's doing the overall case management and the follow-up. And so, for example, if there was someone who maybe can't be reached, and sometimes that happens, there could be the CHR and the public health nurses are the ones that are helping to find those individuals and are actually going out into the community to be able to connect with them and make sure they have the things that they need and they have the support that they need. So I'll stop there, but just wanted to say a yahat to all of the partners that have really been doing all of this work. And I'm sure, on this call, there are many, many teams from many health facilities and community programs over the past several months that have been putting in a lot of time and, really going above and beyond. And so a yahat for all the work that you've been doing to support the community and to really be able to ensure that the type of resources that are needed, the response that's needed, is taking place. So I'll turn it back over to Courtney.
Hi, thank you. Thank you all for your wonderful presentations. They were very informative. We have quite a few questions. So if people don't mind, we can go maybe a few minutes past 4 just to make sure we get everyone's question answered. So our first question is for whoever was able to answer. Are contact tracing activities reimbursable through Medicaid or other third-party sources? I'm not sure if you all have an answer to that.
With regards to contact tracing activities, Aztec doesn't charge for any of the work that we do with our partners. So there is no cost associated with having us work with you on the contact tracing efforts. I am uncertain as to how to answer that for the tribes who do it themselves.
So just to follow up on that, I did speak with someone in our policy department. And so I'll just give a brief summary of what I was told. So from what she said in regards to Medicaid, SMAs need to identify both a state plan service and authority to provide that service. And so defining a service and authority may be a challenge since contact tracing has historically been a public health intervention and not a medical service that directly benefits a Medicaid member. So CMS typically does not allow this type of service under Medicaid. However, given the flexibility under the current disaster declarations, however, CMS may have more flexibility than usual. So some of the options for these services that were mentioned were case management and federal approval rationale. If you would like more detail, please email me. I will put my email address in the chat box and we can give you a little more in-depth information on that question. The next question is, what type of software is recommended to use and are capable with IHS tribal systems?
Hi, I can't really speak to what's available to communicate with IHS systems, but I will mention that within Aztec, we did create our own software to capture all the data that we're collecting via the case investigations and the contact tracing, as well as the case monitoring and contact monitoring. So we have been using that, not with all of our communities, but that is the primary database that we use. And it's called SID, the Southwest Indigenous Database.
Thank you. So this question is for Aztec. How are you managing cases that need to be escalated to a clinical setting?
We are generally in contact with the clinical provider, either the main clinician at the IHS clinic or for the tribes that are 638 at either public health nurse or the medical director of the clinic there. And so we've had, certainly I've personally experienced at least a couple of different cases that have had to be escalated immediately. And so it's a direct call to their provider, who then manages, whether it's transport via EMS to the nearest hospital, or if it's a matter of getting them oxygen, or whatever the case may be. They're the ones who will handle the clinical care from there, but we make it our duty to alert them to the escalation of symptoms.
Thank you. There's one more question for Aztec. How are the isolation sites funded that you all mentioned in your presentation?
I think it's a combination. I know that some are, state funded, and then the ones that are on tribal lands are, funded through the actual tribes.
Thank you. Our next question is, how do you address with privacy of those who are in quarantine with other tribal programs? So it looks like they want to know, how do you take privacy into consideration?
Yeah, that's a good question. For Aztec, all of our staff who's working on this definitely goes through HIPAA training. We have a lot of discussions around, the sensitive nature of this disease that we're working on and how that can, you know, unfortunately result in stigma. And that's definitely not something that we want to add to. So we ensure that everyone working on it is, you know, fully aware of that.
Okay, thank you. This is a question for any of the presenters. Have there been issues with contacting patients or contacts during this time?
Yeah, certainly. I think it's something that Carolyn brought up in one of our lessons learned slide. It can be very, very difficult to have a working phone number, a phone that's on, a phone that's getting reception enough, or they're not in a dead zone. It can be difficult to get people to pick up even if the phone rings because they don't recognize your number, and it can get hard to keep people on the line when it's, you know, someone unfamiliar telling them that they need to stay at home for the next 14 plus days. Yeah, so certainly, I mean, as a very basic answer to that question, yeah, there's been a lot of challenges throughout sort of the linearity of the contacts.
Our next question, how are you all coordinating with state or county contact tracing efforts? And that's open to any of the presenters that would like to answer.
This is Sonia with the COPE team. We've been coordinating very closely with them because the most important thing is that none of the cases or contacts kind of fall through the crack. So for each site, the site is able to determine, you know, if they're going to be working with the state contact tracing team. Actually, you know, for some sites, the Aztec team, and, you know, for Gallup, for instance, we have a hybrid, and we're just very careful to communicate back and forth to make sure that we know who is following whom. And we share data, so we'll actually send our reports to New Mexico or vice versa. So that's how it's been working.
Thank you. Another question we have, what qualifications do you recommend for contact investigators and contact tracers? Again, that's open to any of the presenters.
I think for our team, we've really tried to find people who are very mission oriented, and we've had a lot of success with people who actually are from the community themselves. I think that's actually helped to build the trust and maintain those channels of communication as they're doing the follow-up. And we've primarily worked with people who are either students or graduates in public health or some healthcare profession, although not necessarily everyone.
We also received a question. Someone wants to know, how can effective contact tracing be done over the phone? Again, that's open to any of the presenters who would like to answer.
I can try to take that one. You know, I think that's just kind of similar to a lot of the other issues that we're facing with this pandemic. It's you know, not necessarily something that can be done in person, although that, you know, might be easier. So it's just something that we've had to, you know, do over the phone, and it's not ideal because we do have, you know, a lot of challenges that we've faced, you know, as we've talked about on this presentation, and getting in contact with people over the phone. It's not always the easiest. But we've found that, you know, building relationships with these people that we're calling, and, you know, getting them comfortable with us and our role in contacting them has been really effective in getting them to open up and trust us and rely on us, you know, to guide them through either their isolation or quarantine period.
Thank you.
I have to agree that, I mean, that's, I think in general, how contact tracing has largely been done with infectious diseases. I mean, if you think about HIV being a reportable disease, when that, when that contact tracing initiates, that is usually done on the phone as well. So there is a precedent for it. It is particularly difficult in Indian country where we do have service area issues, and the rurality of which makes it difficult to get good service. We have families sharing one phone, which makes it a little bit tougher too. But as Carolyn mentioned, that relationship building, name recognition, the trust with leadership and the clinic is really critical to getting people to answer their phone and cooperate.
Thank you for that. We have just 3 more questions. And so the next question is for Aztec. Someone wanted to know the fact sheets that you have, can they be customized for someone's area? For example, insert like their tribe's contact information.
We can check on that for you. I don't know. I don't think we have any copyright issues. It is, as Carolyn mentioned, it is artwork that was created originally with one of our staff members who's an artist. I don't foresee a major issue. There might be some tweaks that might need to be made, but please reach out to us and we can put our emails in the chat box so that if you have any other questions, we can try and answer them. But please reach out to us and we will see how we can help you with their request.
Another question for Aztec. What made you choose the within 6 feet in 3 minutes versus the standard 6 feet for 15 minutes that CDC uses?
Yeah, that's a good question. It's come up a few times in our discussions with the New Mexico Department of Health. It is something that the New Mexico Department of Health has issued as official guidance, and so that is what that's what we're following based on the guidance that we've received from our partners there.
So a few more questions have come in. These will be the last 3 questions that we'll have. And if you have any more questions after the webinar, please email me and we will get back to you as soon as we can. Can you expand on how essential isolation housing has been to individuals and communities in addressing this pandemic?
I'm sorry, I'm not sure if I heard the whole question. They were asking how isolation has been effective?
Yes, how essential has it been during the pandemic that you've had isolation housing?
Oh, okay. It has been, very helpful, very successful. As we mentioned in our slides, a lot of homes in the communities that we serve may have multiple family members who aren't necessarily able to stay in a room by themselves or use a bathroom all to themselves. So, in terms of mitigating the spread of COVID within households, it's been very useful.
Thank you. When doing the contact tracing, have you been contacting places people have been, such as gyms? And that's open to any of the presenters.
I think in general, if there is a concern about a workplace or congregate setting, certainly those places would be investigated. So I think, for instance, in our case on Navajo, it might be the clinical team from the facility that would go out and do that specific investigation.
And our last question is, are you enforcing isolation and quarantine, and if so, how?
So Aztec's role is, to help monitor symptoms and be a source of information and, resources for people in isolation and quarantine. We're really not here to enforce anything or, take an authoritarian role. So, you know, the best that we can do is try to understand the barriers that people face to isolating and quarantining, and, you know, work with them and their tribe to try to address those so that they're able to, you know, successfully stay at home or, you know, stay away from other people during that period of time.
Okay, I want to thank everyone. That was our last question. Thank you everyone who attended, and thank you to the presenters. You provided us some great information. I want to remind everyone that the recording and the slides will be available within a few days on our website. You will also receive a link to an evaluation that we ask that you complete. And if you have any questions regarding contact tracing after this webinar ends, you can email me or any of the presenters. Our emails are in the chat box. And if I get any questions, you know, we'll get back to you as soon as we can. Again, thank you everyone, and I hope you have a good weekend and a good rest of your day.